Hi everybody, Al the Psych here, and I've got a presentation today for informational purposes only regarding catharsis, and actually catharsis related to anger, okay, and whether or not it's good for you, okay. So catharsis is an emotional release, venting. Now, when I was starting out as a psychologist, the word was that catharsis is good for you. It's a way to, get rid of pent-up feelings, anger. This is, I'm going back into the 1980s here. Of course, sometimes we're told things that we think are correct, but they're not. Decades ago, we were told that cigarettes were good for us, and Lucky Strike did their so-called research to get doctor endorsements, and I'll address research concerns, in another video. So anyway, I read this article. I'm going to do a lot of reading today. Read this research article entitled, "Does Venting Anger Feed or Extinguish the Flame? Catharsis, Rumination, Distraction, Anger, and Aggressive Responding." This is by Brad J. Bushman of Ohio State University back in, I think, 2001. And the research involves catharsis by subjects hitting a punching bag while thinking about somebody that provoked them. And you can go online and read all the particulars about it. But the conclusion here was, and I'll read this, catharsis theory predicts that venting anger should get rid of it and should therefore reduce subsequent aggression. The present findings, as well as previous findings, directly contradict catharsis theory. For reducing anger and aggression, the worst possible advice to give people is to tell them to imagine their provocateur's face is on a pillow or punching bag as they wallop it. This is precisely what many pop psychologists advise people to do. If followed, such advice will only make people angrier and more aggressive. Okay, so that's one research article. There was another one called the effects of written catharsis on anger relief. This was published in 2021, December of 2021. It was on PubMed. This one was conducted in China. And the abstract reads, previous studies have found that general catharsis, such as hitting sandbags, does not reduce, but increases an individual's anger feeling and aggressive behavior. Although the goal catharsis that is directed at attacking targets can temporarily relieve anger, there's a risk of increasing the tendency of aggressive personality if it is used for a long time. So these findings raise serious doubts and challenges to the traditional view that anger must be released, held by the classic catharsis theory that many people still trust. Okay, so I'm going to go even beyond that. Here's a passage from the book Quiet by Susan Cain, and I took this right out of her book. The catharsis hypothesis is a myth, a plausible one, an elegant one, but a myth nonetheless. Scores of studies have shown that venting doesn't soothe anger, it fuels it. We're best off when we don't allow ourselves to go to our angry place. Amazingly, neuroscientists have even found that people who use Botox, this is kind of interesting, people who use Botox, which prevents them from making angry faces, seem to be less anger prone than those who don't use Botox. Because the very act of frowning triggers the amygdala to process negative emotions. The amygdala is part of the limbic system, which helps regulate your emotions. So that's kind of interesting. So if you're actually frowning more, making, angry faces, you're going to tend to maybe even be a little bit more angry. And actually, I think I've addressed something like that in previous videos. Now, I can remember when I worked in a psychiatric hospital, there used to be what are called Batakas available for the patient to use to help them vent their anger appropriately. So they could use these Batakas, or like a foam bat, to vent their anger, and then they could hit the bed with a Bataka. And unfortunately, I found out over time that it tended to make patients more angry. Okay, and as the research indicates, it actually can make them more aggressive. Okay, and again, I was a young psychologist. Is back in the '80s. I remember using a catharsis technique at a school with a student that was acting out in the classroom. I suggested to the teacher that she let him go out of class and hit a tether ball to get his anger out. And did it work? No, it did not work. What it did is, the teacher told me it actually made him more angry when he came back. Now, to be fair, I mean, you can hit a tether ball and over and get to the point of exhaustion, and then yes, it's going to be like, okay, I'm not angry anymore because I'm whipped. But you have to kind of think of some of the long-term effects. Basically, we're practicing anger and we're practicing aggression, so we're going to just be reinforcing that. Now, if you make a habit of activating your stress hormones, I was looking at some of the physical concerns here. If you make a habit of activating your stress hormones, you run the risk of negatively impacting your cardiovascular system, weakening your immune system, increasing anxiety, and possibly developing depression, having quite an impact on family members if you're increasing your aggressive behavior. And basically, you are running the risk of getting good at venting anger because you're practicing it. So think about that. If you practice, you probably get better at what you do. And you may be more likely to turn this into a default mode where that's the first thing that you do. And if you're a parent, I'm sure you would prefer your child to use other methods of dealing with anger. And if you're married, I imagine you would prefer your spouse to use other methods of dealing with anger rather than this catharsis venting scenario that I've talked about. So, other options to deal with anger: breathing techniques to relieve anger, meditation, physical exercise, breathing exercises, appropriate visualization, art therapy, etc. I will at some point in the future address information from James Pennebaker about writing and journaling, because I think it kind of plays a little bit of a part here as well, but I'll talk about that at a later time. So, from my perspective, anger, catharsis, venting in the way I've described it gets a thumbs down. Okay? Be interested in your thoughts, so if you'd like, go ahead and plug those in, and we're done. Okay?